Good afternoon. We're live. It's Thursday, December 3rd, 2020, and this is the bi-weekly healthcare provider webinar presented by the New York State Department of Health here in Albany. I'm Dr. Elizabeth Dufour, Medical Director in the Division of Epidemiology at the State Health Department. Joining us this week to update healthcare workers with our latest guidance on COVID-19 are Dr. Marcus Friedrich, as usual, as well as Dr. Betsy Rausch-Fung, our Director of our Bureau of Immunizations, Robin Suter, and Dr. Louis Nitkoff. Due to the large amount of interest in our weekly COVID guidance updates, we are offering a few different ways to listen to this webinar, live and on demand. The audio and slide deck can be seen on YouTube Live. Point your web browser to coronavirus.health.ny.gov/weekly-healthcare-provider-update. The YouTube Live player is on our healthcare provider's webpage. It's mobile friendly, so you can watch right on your smartphone or tablet. An on-demand version of the webinar is available via YouTube. Go to coronavirus.health.ny.gov, click on the providers link at the top of the page, then click on Weekly Healthcare Provider Update. It is available immediately after the live webinar concludes. Now we'll go ahead and get started. We have a packed agenda today with a lot of important updates. Updates on the global, national, and New York State testing and case count landscape. Updates on pre-K to grade 12 school COVID testing. Healthcare provider universal eye protection guidance updates. New York State COVID vaccination updates, critical updates today, of course, both on the general vaccination as well as how healthcare providers can enroll to be vaccine providers. Provider wellness, as usual, is an essential component, and then also updates on monoclonal antibody therapeutics, nursing home holiday guidance, the New York State winter strategy, and elective surgery updates, particularly in Western New York. Recordings will be available immediately thereafter, as mentioned, and the link is available here on this slide. And in addition to YouTube, an on-demand version of our weekly sessions is available as a podcast. Just search NYSDOH. So looking at the global picture, reviewing this every week, we think, well, maybe we can cut some of this out. And then it seems that every webinar, there are key updates globally and nationally, unfortunately. And what we're looking at here is that as of November 29th, there have been over 61.8 million cases globally and over 1.4 million deaths since the start of the pandemic, according to WHO situation reports. Over 40% of total cases come from the Americas, with over 26 million confirmed cases. In the Americas contains approximately 50% of the global deaths, with over 720,000 deaths. Now here we see the global epidemic curve, and we see that new cases over the last 7 days have remained high at nearly 4 million new cases over the past week, with the region of the Americas in the yellow-orange color serving as the largest contributor for new weekly cases last week. You can see here the European region reported a continued decrease in new weekly cases now for 3 weeks now, although they contain the second highest number of cases globally after the Americas. And as you can see from the black line, which indicates the death counts, you can see that death rates have continued to increase, unfortunately. In the past week, the three countries reporting the highest number of new cases and deaths, unfortunately, were from us in the U.S. Over 1.15 million new cases over the last week were reported out of the U.S., and that's out of the 1.6 million new cases reported out of the Americas. So the Americas being the biggest chunk globally, and within there, the vast majority coming from the U.S., unfortunately. That equates to 3,476 new cases per 1 million population. The next highest number in absolute numbers of new cases reported after the U.S. at 1.15 million new cases over the last week is India at 297,000 cases, followed by Brazil at 218,000 cases. So important to keep in mind to see where we are nationally in the global picture, which is an area of high concern, as many are aware. Moving on, again, just to have context for our national picture, here we see on the left a graph of the European region, epidemic curve in the middle, the Americas, again, the bulk of this being from the U.S., and on the right, the Southeast Asian picture. As noted in previous webinars, please note that these scales are very different. So while we see in the European and American regions in the millions on the left for case counts over a week time period, we see here with the purple graph on the right of Southeast Asia, it's the 100,000s range. Likewise for fatalities on the right side with the black line indicating deaths in the European region and American region, we see it's in the 30,000 range, whereas in the Southeast Asian graph, it's in the thousands range. So important to note these different scales. What we see here is on the left over the past week, the European region reveals the decline in cases again for 3 consecutive weeks, but a continued high number of deaths. In the Americas in the middle, we see the increase in cases and an increase in deaths as well reported. And finally, on the right, we see that Southeast Asia has a very stable picture of both cases and deaths, with weekly cases in the region in about the 370,000 range, about 80% of which are from India. Again, note the lower scale here for both cases and deaths in the Southeast Asian picture. So now looking at the national picture, we are now at over 13.6 million total cases in the U.S., with total deaths over 269,000, unfortunately. Some outlets, such as the New York Times, have reported that the country has now passed the 14 million mark for total cases and wanted to report that as it is an unfortunate and grim statistic. Notably, in the U.S. 2 weeks ago at our last webinar, we reported on reaching some disappointing benchmarks. Now today we've surpassed those significantly, unfortunately. At that time 2 weeks ago, the U.S. had reported a daily average of nearly 160,000 new COVID cases per day. Again, do the math, this is over 1 million per week as noted in the WHO slides. Now we are at almost 180,000 new cases on December 1st alone. Again, 2 weeks ago, we were concerned about reaching the grim milestone of over 1,600 deaths per day. And now we see a daily of almost 2,500 new deaths reported. Some outlets are reporting the daily death toll is reaching 2,885 on Wednesday alone. Again, this is a concerning figure that surpassed the number set in the early outbreak peak in April. And of course, given the continued increase in cases that we're seeing right now, we do not expect to see this increase in deaths to let up anytime soon, unfortunately. Also notably, there are now more than 100,000 individuals currently hospitalized in the U.S. with COVID, according to the COVID Tracking Project by The Atlantic. This is nearly double the high point for COVID hospitalizations in the spring that were in about the 50,000s. And here you see on this slide the picture of the U.S. map showing the average daily new cases per 100,000 population in the last 7 days. And we see here that certainly New York is not of highest concern here nationally, and we're doing much better than many of our other state peers in the about 35 to 40 range of daily average cases per 100,000. But of course, we want to continue to do much better. Here we see the epidemic curve, and this just gives you a good picture of nationally where we are in cases on a daily basis compared to in the spring and the summer peaks. Again, a very concerning trend. And now looking at our New York State trends as of December 2nd. So first, the good news. So now over 19.7 million COVID tests have been performed on New Yorkers. That would be the equivalent of about 1 per New Yorker had it been spread out among all of our population. Another great benchmark is that on December 1st alone, there were over 193,000 individuals tested in New York State with COVID tests. And that number we see continues to incline and increase steadily. Unfortunately, our total positives is now over 664,000, and the new positives on December 1st are nearly 9,000. Remember, over the summer during these webinars, we would talk about the previous ranges of about 500 to 1,000 new cases per day. And just 2 weeks ago on this webinar, we were at about 5,000 positives. So this is a very concerning trajectory here for us in our state. That leaves us with a total percent positivity of 4.6% among those who were tested. And unfortunately, a total of 26,889 fatalities have been reported due to COVID in New York State. Now here we see the graph of percent positivity, so the blue line being total tested, the yellow positives, and the orange line, the percent positivity. And then listed below, percent positivities by region. So note that this figure of total testing and number positives and percent positivity is challenging, as the number tested really dwarfs the number of positives and leads a almost misleading picture of a small number of positives with a small uptick. And so while that is a good thing that we have this many individuals being tested in New York and that can help contain and control spread, it's important to not only look at this figure, but also to look at the absolute number of positives and the rates per population in various areas. And we'll get to those next. But first, to look at the percent positives, we see here on the first row, the Capital District region. So there were 7,420 persons tested with 346 positive, for a percent positivity yesterday of 4.7%, with a 7-day average of 3.8%. The range of 7-day average percent positivity among all the regions is variable considerably, with 2.4% in the southern tier to 7.4% in western New York. And you can also go to this dashboard, the link is available on the slide, to see the test results and total tested and percent positivity by county. Again, note the percent positivity statewide is 4.6%. If you look at the areas that are under current focus microcluster zones, that's at 5.9%, while rest of state outside of focus zones is 4.2%. But again, it's important to look at the total absolute number of cases as well as the rate of new cases per 100,000 population. And here we see a figure with the statewide numbers. You can also go to this monitoring early warning dashboard to see for each region. And this gives the 7-day rolling average of new cases per 100,000. And this is helpful as it isn't affected by that total number tested in the denominator as the percent positivity is. So we are now currently at 37.3 cases per 100,000 statewide, a significant increase. And as we see, a continued upward trajectory is noted again, as 2 weeks ago in the last webinar, from the rates of 3 to 3.5 per 100,000 in that range over the summer. Notably by region, the rates range again considerably from the lower end in the North Country of 18 per 100,000 to New York City at 30 per 100,000 to Western New York at 55 per 100,000. And now to look at the daily hospitalization summary by region, and here in the graph, the statewide hospitalization totals. Again, for context, on April 12th, we had a total of over 18,800 COVID-associated hospitalizations and over 5,200 in the ICU on April 13th. In the summer, we were around the 400s for hospitalized and around the 100s for the ICU. And now we are at hospitalizations of 3,900 hospitalized, almost 10 times where we were in the summer, and 742 in the ICU, almost 7 times where we were at our nadir in the summer. So again, important to note this important trajectory. And here are some numbers of increases for hospitalizations, ICU admissions, intubations, and fatality. Again, almost 4,000 hospitalizations, increased by 150, almost 750 ICU. COVID admissions currently increased by 24, and intubations within the ICU are at 373, increased by 25. And unfortunately, we're seeing the fatalities increase now at 69. And remember, in the summer at our nadir, we were at single digits there. So now for some brief updates on pre-K to grade 12 school COVID testing in red and orange zones. Given ongoing data, both from New York State and globally, supporting the safe opening of schools, the governor announced that schools located in orange and red microcluster zones will be required to continue testing weekly in order to remain open, but with a goal of remaining open. Schools in orange zones will be required to test 20% of in-person students, teachers, and staff over the course of a month. Schools in red zones will be required to test 30% of in-person student, teachers, and staff over the course of a month. And pooled testing will be allowed so long as the laboratory being used is approved to perform the diagnostic testing in pools, and that all of the reports are then resulted to the New York State Electronic Clinical Lab Reporting System. These protocols represent the minimum standard for schools to stay open, and of course may be adjusted within specific districts based on special circumstances, outbreaks, and number of cases in a district. While local districts are able to close at levels under the closure rule, they're urged to keep K through 8 schools open whenever it's safe. And further specific guidance has been requested and is anticipated to be available in the very near future. Now for a brief update on healthcare provider universal eye protection, as a new advisory went out over the last couple weeks since our last webinar on this topic. That advisory is available on the provider tab of our webpage, and the link is available at the bottom of this slide. The State Health Department strongly recommends universal use of eye protection by healthcare personnel for all patient interactions, in addition to the surgical face mask or the appropriate face mask, caring for suspect or confirmed COVID patients, and N95 where available throughout New York State. Face shields or goggles should be used. Standard eyeglasses are not PPE and do not constitute sufficient eye protection. That's really important to message to all of your healthcare worker staff in your healthcare settings. And this is an important update in that previously the CDC had recommended eye protection within certain areas of transmission. And so this is really consistent with CDC guidance, but really makes it simpler and says this is really recommended throughout New York State, with no need to consider levels of transmission in your community setting. Wearing both face masks and eye protection provides better protection for healthcare personnel who might unknowingly encounter an asymptomatic, a pre-symptomatic, or a symptomatic but undiagnosed patient or a nursing home resident with COVID-19. This is for healthcare settings, including nursing homes. The use of eye protection in addition to face masks additionally might prevent some exposures that would otherwise require a healthcare worker furloughing, such as when a healthcare worker is in contact with a person with COVID-19 who was not wearing a face mask and that healthcare worker does not have eye protection on. And here is the available CDC link for that exposure guidance. The State Department of Health recognizes that PPE supply shortages might prevent the universal use of eye protection in all healthcare encounters, and so should that situation arise, the shortage should be documented, and eye protection should be reserved and considered required for the care of patients and residents with symptoms consistent with COVID, known exposure to a person with COVID, or in settings with a higher prevalence of patients or residents with COVID. Those might include, but are not limited to, emergency departments, outpatient clinics and practices which routinely see patients with acute infectious diseases, and nursing homes which have recently had residents or staff positive for COVID. Again, healthcare facilities and practices are referred to the State Health Department and CDC guidance on the extended use and cleaning and disinfection of eye protection as a contingency strategy for PPE conservation where needed, and the links are available on this page for that information. A very brief reminder about advising patients and communities on isolation and quarantine. Please remember to tell all of your patients and community members to stay in isolation while awaiting test results. And once resulted, you can give them advice on isolation for that minimum of 10 days and quarantine of their contacts. And again, here are some flyers that can be used and can be ordered to share information on those topics. Now for some important and hopeful topics and review of updates on the COVID-19 vaccine.
Hello, this is Dr. Elizabeth Rausch-Fung from the State Bureau of Immunization. I'm going to talk about some brief updates on Pfizer's and Moderna's COVID-19 vaccines, an update on this Monday's meeting of the CDC's Advisory Committee on Immunization Practices, or ACIP, and what we know so far, expected timeline of COVID-19 vaccine approval and recommendations. It is a messenger RNA vaccine that encodes the SARS-CoV-2 spike protein, given as a 2-dose series with 21 days or 3 weeks between doses, and it does have very strict storage requirements at ultra-low temperatures. It will ship in specially designed thermal shippers with dry ice. It will come with dry ice for an initial replenishment lasting 5 days. And if you don't have a ultra-low freezer and or enough dry ice for further replenishments, it is stable in the refrigerator for up to 5 days, but you have to go from colder to warmer temperature. You can't start in the fridge and then move it to a freezer. Pfizer announced a vaccine efficacy rate of 95%, which was found similar rates in people with and without prior SARS-CoV-2 infection, as well as across all the age, gender, race, and ethnicity groups that they tested, including adults over 65. They found 9 severe cases of COVID-19 in their placebo group and only 1 case in the vaccine group, suggesting it may also be effective in reducing severe cases. To date, there have not been any serious safety concerns observed. However, most adverse events were mild to moderate and lasted 1 to 2 days. The most common severe adverse events were fatigue in about 4% and headache in about 2%. And older adults tended to report fewer and milder adverse events. But it is important to note there were fairly high rates of mild to moderate adverse events, especially pain after either shot. Appeared to be perhaps a little bit more pain after the first shot. And notably, about 25 to 40% of vaccine recipients reported fatigue after dose 1, increasing to 40 to 75% after dose 2. There were also some significant rates of chills and fever, particularly after dose 2. Pfizer and BioNTech submitted their request for an emergency use authorization, or EUA, on November 20th, and the FDA has scheduled a public meeting of the Vaccines and Related Biological Products Advisory Committee, or VRBPAC, on December 10th to discuss the Pfizer and BioNTech vaccine. They expect to produce up to 50 million doses worldwide this year and up to 1.3 billion doses by the end of next year. Moderna's vaccine, very similar methodology, another mRNA vaccine encoding the SARS-CoV-2 spike protein. Also a 2-dose series, but important to note that these Moderna vaccine doses are given 28 days or 4 weeks between doses, so different schedule than Pfizer's. And they won't be interchangeable. If a patient starts a vaccine schedule with one vaccine, they should complete it with the same one, not switch brands mid-series. It has different storage requirements. It's stable for up to 6 months in standard freezer temperatures at minus 20 degrees Celsius and up to 30 days in the refrigerator at 2 to 8 degrees Celsius. It is also stable at room temperature for up to 12 hours, but once it's thawed, you have to either administer it or dispose of it. You can't leave it on the counter and then move it into the fridge or freezer. Moderna has also announced their phase 3 efficacy findings, reporting a vaccine efficacy rate of 94.1%, consistent again across age, race, ethnicity, and gender groups studied, so very similar efficacy findings for both the mRNA COVID-19 vaccines. In their study, they found 30 severe cases of COVID-19 in the placebo groups and none in the vaccine group, which is an extremely encouraging finding. Likewise, no significant safety concerns identified for Moderna's COVID-19 vaccine, but like Pfizer's vaccine, it is very reactogenic. Although most adverse events were mild to moderate, the most common severe events reported in their phase 3 trial was severe fatigue after dose 2 in about 9.7, about 10%, myalgia in about 9%, arthralgia in about 5%, headache in almost 5%, injection site pain in about 4%, and injection site redness in about 2%. And that's, again, note severe pain and redness. Any level of pain, about 80 to 100% of vaccine participants reporting some degree of pain after either dose or both doses of the vaccine. So that's important to keep in mind and warn your patients to expect pain. Usually only lasts a day or two, should get better with time, but to notify you if it doesn't. And like the Pfizer vaccine, 25 to 40% reporting fatigue after dose 1 and 70 to 80% reporting fatigue after dose 2, as well as some significant rates of fever and chills after dose 2. So important to be aware of and warn your patients about. Moderna has now also submitted their EUA request to the FDA. They submitted it on November 30th. So I can now correct this. I wrote potential VRBPAC meeting. FDA has confirmed the VRBPAC meeting on December 17th. So on December 10th, VRBPAC meeting to discuss Pfizer and BioNTech's vaccine. December 17th, another meeting to discuss Moderna's. And they expect to have 20 million doses in the U.S. alone, additional doses in other countries by the end of this year, and between 500 million to 1 billion doses worldwide next year. The ACIP, CDC's Advisory Committee on Immunization Practices, met to discuss the prioritization of what they call Phase 1A, those initial vaccine doses. So as you've probably heard, we don't expect on day one or even week one that there'll be enough vaccine for the whole United States. So this was a discussion of who should be in that first group to be vaccinated. And they recommended the initial doses of COVID-19 vaccine to be offered to healthcare personnel and residents of long-term care facilities. And it's important to note that they define healthcare personnel as including both paid and unpaid people with the potential for direct or indirect exposure to patients or infectious materials in healthcare settings. And long-term care facility residents being adults residing in facilities that provide a variety of services, including medical and personal care, to people who are unable to live independently. Quick timeline, we went through several of these. Of note, we expect the FDA and ACIP to act pretty quickly after the VRBPAC meeting, so potential window for EUA authorization and ACIP recommendations on Pfizer's around December 11th to December 14th, and Governor Cuomo announced he expects first deliveries of COVID-19 vaccine in New York on December 15th if everything goes well and on time with the federal government.
This is Robin Suter. I'm the director of the Bureau of Immunization, and I'm going to be talking about New York State COVID-19 vaccine program provider enrollment. And just to clarify, the New York State COVID-19 vaccine program enrollment that I'm speaking about today is for healthcare facilities with locations in New York State outside of the 5 New York City boroughs. Enrollment is completed through an application in the Health Commerce System, or HCS. New York City locations should enroll in the New York City Department of Health and Mental Hygiene program through the City Immunization Registry. So what happens maybe if you have some sites in New York City and others outside New York City? So as an example, a parent healthcare organization headquartered in New York City, for example, the Bronx, may have sites both outside New York City, say in Westchester, and inside New York City, Bronx and Queens. So you're going to need to enroll the non-New York City sites in the New York State Department of Health HCS application, and then separately enroll the New York City sites in New York City's system through CIR. Later today, December 3rd, we will be sending out information through IHANS and provider associations and some additional methods that will give you a complete package of information. And it's important to review that information, which will include an enrollment instructions guide and provider agreement documents before you go into the HCS online tool to complete the information. Those documents will provide context and explanation for the information you'll need to enter into the online tool. So the sections of the enrollment application include Section A, a provider requirements and legal agreement, and this part specifies the conditions of participation and must be filled out for the organization, so the network, the health system, the medical group, essentially the parent organization. And then Section B, program provider profile form. This must be filled out for every vaccination provider location receiving COVID-19 vaccine. And that part collects info on various demographics, including address, practice type, patient population, and storage capacity. So note, if you are a group, that is a parent organization with multiple locations, you will submit a single Section A and multiple Section Bs together in one application. If you are a single practice or clinic, you will have one Section A and one Section B. So as we just discussed, all vaccine administration sites will need to complete an application in the Health Commerce System. Cold chain storage and handling requirements for each COVID-19 vaccine product will vary from refrigerated, 2 degrees Celsius to 8 degrees Celsius, to frozen, negative 15 degrees Celsius to negative 25 degrees Celsius, to ultra cold, negative 60 degrees Celsius to negative 80 degrees Celsius temperatures. And I know you've been hearing a lot about that. Ongoing stability testing may impact these requirements. To enroll, you must have capacity to store vaccine in at least one of these categories. Vaccine will be ordered through the New York State Immunization Information System, NICIS, and a reminder, this applies to New York State providers outside of New York City. New York City providers will be ordering through the CIR. And based on expected initial limited supplies of vaccine, orders may only be partially filled. Vaccine will be shipped directly to the facility from the vaccine manufacturer or CDC distributor. And ancillary supplies will be included with vaccine shipments. Each kit will contain supplies to administer 100 doses of vaccine, including needles, syringes, alcohol prep pads, surgical masks, and face shields. Kits do not include sharps containers, gloves, and bandages. Reporting of all administered COVID-19 vaccine doses is expected to be required within 24 hours of administration. So to get ready for this process, review the instruction guide and other resources that will be provided later today, once you have access to them. Ensure that you have a Health Commerce System account. Determine if your locations are set up in NICIS with an organization account and appropriate staff have NICIS administrative user access. And more information regarding those accounts and NICIS information will be provided in the letter and information being distributed later today. And be ready to report adult vaccine doses in NICIS. We know there are going to be a lot of questions about the enrollment process, and we expect a high volume of inquiries. So, to help yourself be prepared when you get that package of information, please again refer to that enrollment instruction guide. You can take the advantage of viewing a 30-minute recorded webinar for a walkthrough of the online application tool. And that, again, that link will be provided in the information distributed later today. And we are going to have a series of live, what we're calling office hours enrollment Q&A webinars, where we'll have a very brief overview at the beginning and then have the opportunity available to you to ask questions after you've looked through the materials and then are working on the process and have some additional questions. The documentation that we send out later today will also have an email address for you to send questions to. Thanks so much.
Thank you, Robin. And those materials should be posted on the provider tab of our New York State Department of Health COVID webpage as well. Very briefly, we just wanted to alert you to a couple of webinars coming up before we go on to our next modules here. So Steps to Physician Wellness and Resiliency, a live webinar Thursday, December 10th with Misny, and COVID-19 from a patient-physician perspective, live webinar Wednesday the 16th. And now we'll hear more from Dr. Marcus Friedrich, Chief Medical Officer, Office of Quality and Patient Safety.
Hi, everybody, and thanks for joining this afternoon. Thank you, Liz. I wanted to talk a little bit about the COVID-19 monoclonal antibody therapeutics. As you have seen, there are two of those currently approved by the FDA, and I just want to make sure that we all understand these are part of the U.S. Department of Health and Human Services, and there is an office, it's called the Assistant Secretary for Preparedness and Response. They have a really great website under COVID countermeasures. Apparently they have gone in contract with the two manufacturers, Eli Lilly and Regeneron, on the monoclonal antibodies, and on the licensed products they have remdesivir, the convalescent plasma, and these two monoclonal antibodies. Let's talk about the first one, bamlanivimab. That is the Eli Lilly monoclonal antibody that was approved. There are, again, this is coming from Health and Human Services directly, and the state, we were asked to provide a list of hospitals and hospital-affiliated infusion practices for the phases of giving this medication to the outpatient setting. We are in phase 1. There were already like 2 weeks of supplies. The amount is not very high. You can look at the website actually how many doses we received. And then we are currently like in phase 2, and that is kind of the third batch that is coming to us. And we are currently working on the expanded distribution to the outpatient service and outpatient side. But again, I want to make sure that we understand that the allocation is based on the rules that HHS is giving us here to the state, and they based the dosing on the total number of confirmed COVID cases and the total number of confirmed hospital patients during a 7-day reporting period. And that's why the distribution in a look back is probably lower here in New York than we would usually get based on the population. And again, we're getting a lot of questions from providers out there. How can they get a hold of this? The one rule that they made is that this can only go to licensed infusion centers that have currently a pharmacy license, and that has to do with the distribution. And it's not New York State who's distributing but there is a company, a subcontractor, AmerisourceBergen, who is distributing that, and they are looking for providers who have a pharmacy license who can accept this medication. The last, on November 21st, there were 2 monoclonal antibodies approved, but that is one infusion from Regeneron, and the monoclonal antibody is Casiri VMAP, and the second one is MD VMAP, and come again together in mild and moderate COVID, has shown to reduce hospitalization and ER visits within 28 days. Again, it's an IV infusion, should not be used for hospitalized patients. There is a grade, and I looked this morning on the ASPR, the Assistant Secretary for Preparedness and Response website. There is a great FDA fact sheet for those of you who are interested to know more about it. And again, New York received a very, very limited amount of dosing, and at the moment we are again prioritizing hospitals for now, but again in another phase we want to expand the distribution to the outpatient setting if they adhere to the criteria that were set forth. It needs to be a licensed infusion center with a pharmacy license, so that can be then distributed. The next topic I want to briefly talk to you out there about the nursing home holiday guidance. This is important for our patients, not only patients that are in nursing home, but maybe our patients who are planning to visit during the holidays their loved ones in nursing home, or even getting the loved ones out of a nursing home to celebrate the holidays with them. Again, we want to make sure and ensuring the health and safety and quality of life during the holiday season. The first topic, and I just briefly summarize, is that nursing home personnel should avoid parties and social gatherings, that New York State DOH and also CMS recommend against residents leaving the nursing home for family visits because of the community spread that is going on. If a nursing home residents would leave, it needs to, when they come back, needs to be quarantined for 14 days and improved or increased testing. And there is a new visitation guidance that was posted on September 17th, and I would refer to that. But again, I think these are difficult times for all of us, especially if we have loved ones in our nursing home. But we want to make sure that COVID, especially in what we've seen in March and April, is not spreading to this most vulnerable population at the highest risk group in the nursing home. The last and not least thing I just want to mention, for those of you who have been following the governor know about that, it's the 5-part winter strategy, thinking about our preparedness here in New York from different levels. The first is managing the hospital capacity while strengthening this approach that the governor and our team has done on the microclusters, and making sure that we include factors like regional bed capacity, ICU capacity, staffing ratios into these 3 zones. There is another what we call an emergency stop level that is being added to the 3 zones that are already working very well here in New York. And then, of course, making sure that the hospitals that they increase the bed capacity. There is a stop in elective surgery in one of the regions, and I will talk a little bit about that. And then, of course, that they are able to balance the patient loads. The second of the 5-part strategy is increasing the testing resources. I just want to briefly mention the third is keeping the schools safely, especially K-8 and special education schools for the time being. The fourth is preventing the viral spread from small gathering. And this is like an interesting fact that 65% of all the cases that we're seeing right now here in New York happened apparently in a smaller gathering. And smaller gathering is people under 10. And therefore, there is a advisory that should limit the gathering of to less than 10 people, and just making sure that we are not seeing an increase of those cases anymore. And then the last but not least, and we heard enough from Betsy and others today about the operationalizing of the vaccine program and making sure the 3 main pillars are really adhered to, that we call fairness, equity, and safety. And then a quick note about the elective procedures in Erie County. The governor announced on Monday that the hospitals in Erie County have on Friday to postpone what we call the non-elective procedures in Erie County hospitals. This is just for the providers out there. This is not the case for ambulatory surgical center, for office-based surgery practice, or diagnostic treatment centers out there. And that was a little bit unclear in the beginning, but we are glad that has been clarified. And also I just checked the guidance or the directive can be downloaded from the DOH website under, if you type in coronavirus.health.ny.gov and then on the provider tab, and if you scroll down, there are all the guidance documents, including the provider compilation. Again, for those of you out there who want to have a concise document where everything is linked on it, that you can use in your office, please feel free to download that. And then our colleagues from the epidemiology department and the Office of Public Health were very busy. There are a couple other guidance documents that are being prepared, and most of them are already out. A holiday donation and charity guidance document during COVID, a holiday advisory for retailers, or the holiday shopping guidance document, and then the holiday guidance for food service, for indoor and outdoor food service. And again, this all can be found on our DOH website with that. And with that, thank you very much. Liz, back to you.
Absolutely. Thank you, Marcus. And now, quick tips for clinician well-being in the era of COVID with Dr. Louis Nitkoff.
Thank you, and good afternoon, everyone. We're back this week with another installment of Coping with COVID, part of our focus on clinician well-being. Even in the face of the extraordinary demands that are being caused by the surge in COVID infections, it's important to not lose sight of other things that really matter, including time with loved ones, spiritual health, which means different things to different people, but it can be thought of as a feeling of peace with life and an ability to find hope and comfort even in difficult times. For some individuals, it's related to faith, and for others, it's not at all. It may be a matter of being true to one's values and ethics, the positivity that comes from volunteerism and social action. It's important to devote time to adventures, which these days are mostly virtual, hobbies, leisure time activities, self-care, and also laughter, which is more than just a state of mind. There are certainly positive physical and biochemical changes that are associated with laughter, even brief periods of laughter throughout the day. So one of the reasons that the pandemic and the restriction in our mobility and our activities has been so stressful is that human beings are creatures of habit. We're programmed in a way to get upset when reality doesn't meet expectations, so we miss the structure of our daily pre-pandemic routines. And we actually miss their regularity more than their substance. So even mundane things like how we shower, how we dress, how we tie our shoes, are things that become ingrained in our behavior. And if we're forced to do those things in some other sequence or some other way, it's stressful in its own way. Establishing new routines can be key to coping with all forms of upheaval, and it's important not to get stuck in neutral. In other words, don't think that we can just ride this out until it's over. It's important to look for new routines and establish them and to fall into them as quickly as possible for the sake of regularity and predictability and sort of, peace of mind. Along these lines, things that we once took for granted now require more mental effort. They may require thought, risk analysis, and significant brain power. And as you work through this, each of us as individuals, as we work through this, it's important to try to find what works for us. We've talked in the past about the importance of checking in with others, checking in with ourselves. Meghan Markle, the Duchess of Sussex, who is now living in the United States, had an op-ed in the New York Times in the past week or so in which she disclosed the fact that she had a miscarriage earlier this year and talked about the healing power of just asking people, "Are you okay?" It's a brief piece and definitely worth the read. And this ties into how we can be supportive and how we can care for our loved ones during the pandemic. And as much as it has disrupted our routines, it's also caused mental fatigue, which results in anxiety, depression, and in some individuals, substance use. The physical distance that is required of us diminishes social support, but being alone does not necessarily mean feeling alone. There are certainly ways to connect, to be attentive, to ask questions of our friends, loved ones, and coworkers. And it's important that we normalize conversations about mental health, pretty much the way we would normalize conversations about physical health. If we knew someone who had a physical problem that they were struggling with, we wouldn't really hesitate to talk with them about it if we knew them well enough to have that kind of relationship with them. And the same should really be true with respect to symptoms of anxiety, depression, and other mental health issues. It's important to ask if there's suspicion about whether someone is experiencing thoughts of self-harm or suicide. And if they articulate this, it's important that we affirm and validate their feelings, but also don't promise confidentiality in the event that they really need some sort of professional assistance. And that's a situation in which we really cannot ethically remain silent. And as with any other situation, it's critical to stay connected and follow up. Equally important is asking, "Am I okay?" This is a chart that I acknowledge Tiffany Leung, who's a colleague of mine from the American College of Physicians. She's an American internist currently living and working in the Netherlands. And this, shows four sort of scenarios, green, yellow, orange, and red. And if you're in the green zone, it's great. Things are going smoothly, and you should try to be mindful of what you can do to stay there. If you're in the yellow zone, then you need to ask, what can I do to get into the green zone, and what can I do to avoid going into the orange zone? And likewise, with orange, you want to be able to move to the left on this chart and avoid moving into red. And if you're in the red zone, you're truly in crisis, and it's time to seek professional help. And as we've mentioned in the past, including our session a couple of weeks ago, there are a number of different resources to tap into. There's a National Suicide Prevention Hotline, which is 1-800-273-TALK. Medical Society of the State of New York has its peer-to-peer program, which can be accessed at 1-844-P2P-PEER or p2p@misni.org. And that's the number 2, P2P. The importance of talking about these things is illustrated by this quote from Adam Hill, who's an internist at the Indiana University School of Medicine. And he, in recent months, has been very public about his own struggles with mental illness and his own suicidal thoughts, which he's had in the past. And he thought of the time a young patient confided in him about feeling suicidal because she had heard him talk about his own issues and his own struggles publicly. She said how important it was for her to be able to trust a doctor who spoke his own truth so openly. And when he thanked her for that trust, she replied, "No, I thank you." And I'll leave you with the words of Duane Reade, who is apparently known as America's favorite rapping teacher. He's in Chicago, and not to be confused with the pharmacy, Duane Reade. "My job is not my life. My job is not more important than my life, and my job is not going to take my life." Important words for all of us to carry forward, as at times it seems we become increasingly consumed with what we're doing professionally in healthcare. So as always, we here at the department are grateful. We thank you for all you do to help others every day, and we welcome your suggestions and feedback about this programming. Back to you, Liz.
Thank you, Dr. Snitkoff. Now, again, at the end, we have our usual resources for you all as a reference. So you have them here on the slides that recommend to your patients and communities to sign up for the COVID Alert app, which can help us all to be alerted anonymously when you may be in close contact with someone with COVID. Again, the peer-to-peer program from MSNY was mentioned, and some of the other resources, the Frontline Worker Hotline for Wellness and the Mental Health Hotline for either frontline workers or for the general community, and all of the other resources as previously mentioned on telehealth, the healthcare provider compilation. Here's the link. And again, for questions about any of this, or if you want to submit questions for this webinar, you can submit questions to covidproviderinfo@health.newyork.gov. Mirror clings for your practices or community settings to encourage hand washing, and other flyers that can be used on face masks and coverings, stopping visitors, those hard of hearing. We will mention before we get to any question and answers that we will have our next healthcare provider webinar update on COVID in 2 weeks' time. However, in the interim, next week, given all of the urgent updates and essential updates with COVID vaccine, we will host next Friday a webinar at 1 to 2 p.m. next Friday, the 11th, on COVID vaccine for healthcare providers, all COVID vaccine updates. This is because next Thursday is the VRBAC meeting mentioned by Dr. Rausch Fung. So the FDA VRBAC meeting on the Pfizer vaccine will occur on the 10th. And so on the 11th, we will provide a summary update for you all of that VRBAC meeting, as well as other key COVID vaccine updates at that time, Friday, December 11th, 1 to 2 p.m. And then we will hold our routine healthcare provider webinar update the following week, again, including vaccine content, but also including other essential content on case counts and other advisories, guidance documents, and containment measures. Now, Dr. Friedrich, I'm going to ask you a question. We've had quite a number of questions about the monoclonal antibodies. So could you again review, as this question states here, I'm a healthcare provider in the community. And I'm hearing that providers can order the monoclonal antibodies from the state. How do I go about doing this, and how should that be used?
Thank you, Liz. And this is a question that we are hearing quite often. Again, you have to make sure that you are checking the boxes, that you are an infusion center that has a pharmacy license. And we are here at DOH going right now through thinking about a process, how either it's a application process or as simple as going through the associations, making sure that we can sign up providers who are willing to and who have the space for being an infusion and have the license to be an infusion center and a pharmacy license, how they can apply to the state. And more to come, I think, on the next webinar. We will have some updates on that. Again, the department is currently working on a process to make sure that we can provide the medication to the community providers in a safe and consistent manner, and more to come on that. Thank you, Liz. And I also want to, thank you for listening in this afternoon. Thank you what you're doing out there. We know this is difficult right now, especially with the number of cases increasing and so forth, but we are really appreciative of all the things that you're doing, helping your patients, and hopefully you're taking care of yourself as well. So with that, have a good afternoon, and thank you very much.
Thank you.